right, guys, welcome back to the Blue Vue. And this is Shawna from Right. Today we're going to be talking about a number of things. We're going to be talking about stem cells. We're going to also be talking about weight management. So looking forward to chatting with you.
Yes, please.
She had some burning questions, so
there's been a lot of debate about stem cells, if they're safe, if they're unsafe, if they're ethical, if they're moral. So can you first tell us a bit about what stem cells are?
Sure, I think that's always a good place to start. Because once you see something which is too controversial in the market and there's too many things surrounding it, sometimes the truth and the basics get lost. So it's a very good question to ask, what exactly is a stem cell? All right, so a stem cell is nothing scary, it's just to be understood. And so all of us start off as stem cells. We're all just the result of stem cells. So the stem cell system begins at the time of fertilization of the egg, when the sperm comes together and the egg come together to form an embryo or to form a baby, basically speaking. Essentially, the sperm and the egg, they carry certain markers in them. And the first thing they do is create what is known as a totipotent or an omnipotent stem cell. And that's actually stem cells which have the capacity to produce life, to produce an organism. And the way that stem cell knows to do this is because of the messages which is being carried by the sperm and the messages which is being carried by the egg. So once the two of them come together, then life starts to form. And the next thing that stem cell does is that stem cell then produces what's known as pluripotent stem cells. And pluripotent stem cells now have the capacity now to then differentiate into different organs, into different organ systems, whether it's the heart, the brain, the liver, the kidney, the skin, the hair, everything about it starts off as stem cells. So you start first of all with the totipotent stem cells, which basically say, okay, we're going to make a life here, all right? And then they differentiate into, or differentiate or become. So the word differentiate just means become. So then they become pluripotent stem cells, which then start to become different organ systems. So these pluripotent stem cells then become multipotent stem cells. So each time you are losing the potency to create multiple different structures, but you're becoming more specialized and more capable of creating a specific structure. So when you go from the totipotent to the pluripotent, then to the multipotent stem cells will be more specific, for example, at creating cartilage, creating bone, creating muscle tissue, creating heart tissue, creating blood vessels and these cells on the lining of the blood vessels. And then it continues all the way down until you can get to a unipotent stem cell, which only can do one thing. So stem cells essentially are what make up the foundation of the entire body. So it's a very interesting system.
Okay, so I'm listening to you and all of the doctor speech, more or less.
Right.
But what I want to know is, are they safe? Should I be afraid of the stem cells? I know that many Barbadians are like, stem cells? Were you taking something from a fetus? Is this safe? So can you answer that burning question? Is it safe to use stem cells?
Yeah, and it's absolutely safe, and we shouldn't be afraid of stem cells. And so the reason why I went through that whole distinction to help you understand is because we're going to start to drill down into each of those categories. But let's start by saying it's absolutely safe. You can't be afraid of stem cells because you are stem cells. That makes sense? So we are stem cells. What people are more afraid of is when human beings start doing silly things or start doing dangerous things. In other words, they're messing with nature, or they're going about messing with nature in an unethical way, okay? Because as scientists, as physicians, as human beings, our job is to adapt to the environment, right? So that's what separates a human being from everybody else, is our capacity to adapt, all right? So one of the ways in which we adapt is that we investigate things and we see how those things can make human life better. So this is the exact same thing which is happening right now in the stem cell debate. So the real controversies now start to occur. At which level are you taking these stem cells? Okay, so we went through, we talked about the all-potent stem cell, and then we talked about the pluripotent stem cell, and then we talked about the multipotent stem cell, and now we're talking about the unipotent stem cell. So which one of these cells can we now extract and begin to utilize? And in doing so, is this safe? Is this going to cause a problem, or is it even the right thing to do? So I think that Barbadians have been exposed to stem cells in the past in a very negative way. There's a strong history which date back sometime around the mid to early 20s and 2000s, and essentially there was a situation where people were doing unethical things in order to harvest stem cells to give to people.
Yeah.
Certainly this is nothing that we want to ever be a part of as a nation. And you know, we're going to invite people from all over the world. They come to our clinic right now. Over 60 to 70% of our clientele comes from outside of Barbados. So it's important that when they come here, that they come to a place which is moral, which is ethical, which has quality standards, which puts safety as a #1 thing. And then we can start to drill down, okay, how do we do this? And furthermore, how do we allay people's fears?
I know that most persons, you know, if you watch like Good Doctor or Grey's Anatomy, you will see stem cells being used to treat cancer patients or so on. But as it pertains to aesthetics, how can stem cells be used in the body to give you that, you know, Hollywood finish, but still be safe?
Sure, and certainly we should think of stem cells in multi-uses. All right, of course, you mentioned correctly that you can use stem cells to treat cancer. For example, if you take bone marrow stem cells from a donor and you give those bone marrow stem cells to a recipient, then you can help that recipient whose bone marrow is probably being shot by the cancer, for example, like leukemia, to treat that, okay? So that's a specific type of bone marrow stem cells, which are known as adult stem cells, which come from the bone marrow. Now, in the field of plastic surgery, we can also apply stem cells, yes, to aesthetics, but we also apply stem cells to reconstructive and regenerative you know, conditions, okay? So it's really important to understand that it has a massive broad use. So let's drill down a little bit into the types of stem cells that are available to us, because I think this is some of where the controversy occurs. Okay, so we talked about all the different types of stem cells. Remember, that's our foundation of our conversations, to understand that there are multiple different types of stem cells. But then you ask ourselves, okay, how can we get these stem cells, all right? So typically speaking, there's a couple of areas where we can extract these stem cells. If you're extracting stem cells from an embryo, for example, okay, you can get pluripotent stem cells. You can also get pluripotent stem cells from umbilical cord, okay, and also from what's called Wharton's jelly, which is a part of the whole umbilical cord system, all right, and the placental system. So in extracting these stem cells, then they have various uses. Now, what we should not be doing in clinical practice is using embryonic stem cells. Embryonic stem cells, obviously, it involves the destruction of an embryo, okay, so that has to be done in a very controlled setting. Really and truly, the best way to put it is that should be occurring in a government lab under strict conditions where we're going to study the embryonic cells. And quite frankly, all across the world, a lot of people are not interested, even at the governmental levels across the world, they're not interested in studying the effects of pluripotent stem cells from the embryo, because it's just clearly a lot of ethical issues and moral issues which surround that. The other reason is that they're not entirely safe. Okay, so we're asking about safety, and we can get into which stem cells are safe versus which stem cells are not safe. So if you're extracting stem cells from an embryo, then there's a possibility that they can turn into what's called a teratoma, which is a fetal type tumor. And there's also a possibility that they can turn into other types of tumors as well. So they are tumorigenic, okay? They can produce tumors. So nobody wants to be a part of that, yes.
So I know that was a concern that, you know, members of the religious and so on community had as it pertains to that. But I'm glad that you're saying that right now in Barbados and the wider Caribbean, we're not looking at embryonic stem cells. We're looking at the other stem cells that are safe to all persons to be used.
Absolutely. And I'll tell you which ones are the safest ones as well. So, but I wanted to go back to the whole aspect of the embryonic cells, because we have to think Barbados and Caribbean, yes, but we also have to think external. We have to think that, you know, the world is a large place, but it's a small place all at once. And really and truly, I'm pretty much against the utilization of embryonic cells, unless it is a very controlled setting, okay? And so 100% we should not be using embryonic cells at all, especially within the clinical setting, which is office-based, okay? So that brings us to what stem cells can be considered to be safest. Well, the safest consideration of stem cells would be your own stem cells, because you can't react to your own stem cells. Whereas if you're getting stem cells from somebody else, you can get what is called a graft versus host disease, which can then cause all sorts of problems with your immune system, and it can also cause immune fatigue, which can then leave you exposed to getting other types of conditions, including what you can describe as the cancer formation type, changes within the body because your immune system is suppressed. So you don't want to get that.
So what you're saying is that basically your body may reject it?
Your body can reject somebody else's stem cells, just like your body can reject somebody else's organ in an organ transplant. So this is known as a graft versus host disease. So in other words, you're bringing something from outside, you put it into the new person, but the new person's body does not accept it. That can occur with organs such as a heart transplant, kidney transplant. So there's a lot of studies and testing that go into something like a heart transplant, obviously. But ultimately speaking, you can get what's called a graft versus host disease, okay, or rejection of that person's cells. So the best thing to do is use your own cells. So let's talk about what your own cells are. So you can get your own cells to use in a variety of different ways. And the safest and most abundant way or place where you can harvest stem cells for yourself are from, guess what, body fat. Good old body fat that everybody hates, which we call liquid gold.
You want to get mine now?
Yeah, so body fat it carries abundant stem cells, and these are called adipose-derived adult mesenchymal stem cells, and they're multipotent cells, but they're very efficacious, which means that they can be used to treat a number of things. Okay, now if you're getting your own stem cells. First of all, the fat cells are very interesting cells because fat cells don't really age like other cells. They tend to stay very young. They age maybe 7 to 10 times slower than other cells. Okay, so they are relatively young cells, even if you're getting adult stem cells from older persons. Let's say a person who's in their 80s, their cells are still relatively young. Okay, so the good thing is that we can easily extract fatty stem cells once we understand how to do liposuction, which is the whole, that falls into the whole realm of plastic surgeons, right? And so we can extract somebody's stem cells from their body and we can give those stem cells back, okay? We can activate those stem cells because they're in our fat, but they're not really activated. So we can extract them out. So the whole process of utilization of the stem cells is to isolate the cells, okay? So we can do a little liposuction on someone, all right? Sometimes people want a little bit more than a little liposuction. They want a big liposuction, and we can have all this fat available, which we call liquid gold. So then what we can do is that we can extract out the adult stem cells out of here, okay, which are multipotent, and we can use them to treat a number of different conditions, okay? So it makes it really exciting because it's safe for you. You're never going to react to it, okay? Yeah, I mean, your body would just treat like a normal morning breakfast. Whereas if you're having stem cells from another source, then there's a chance that you can definitely have reactions to it.
So how is the extraction done? You mentioned the liposuction and the liquid gold, so I know it's in a thing like this. But then how do you get the cells from there? Sure.
Well, you have to process the cells using a very highly specialized equipment. Okay, so after you do the liposuction, you can do a big liposuction, as I mentioned, or a small liposuction. And you do liposuction, you extract out the fat that you need, and then you have to process this fat on site within your lab. Okay, and oftentimes it's done within the same operating theater that we're doing the liposuction. And once you process that, once you take it through a processing, highly specialized equipment, then we can extract and count the cells which are located within the fat, and we can extract that out in something which is called a stromal vascular fraction. So it makes it extremely available to the individual. And now stem cells are used to treat all sorts of conditions, okay? But it must be clearly understood that the patient needs to recognize that stem cells are still, quote unquote, in the investigatory stage. And so there's still a big field that needs to be developed. So we certainly should not be making promises to people which are over, we don't want this to be the next snake oil. We want people to have a realistic understanding of what it may or may not be able to do for them. But having said that, it's been used quite effectively over the last 20 years or so to treat all sorts of conditions. Adult stem cells from fat, I'm talking, such as connective tissue disorders, such as muscle pain, joint pain. I had stem cells injected into my knees about 12 years ago because I used to get a lot of pain from martial arts and football injuries. And after injecting it, certain things went away. For example, I no longer got pain going up and down stairs. And I could squat, although I still am careful when I'm doing squats in the gym, all right, or leg extensions. So it 100% improved. I wouldn't say that it was 100%, but to me it felt like a 100% improve, okay? But we still, I still get issues from time to time, so I'll probably repeat the treatment again. But then you can utilize these stem cells because they're very effective in bone and joint injuries, muscular skeletal injuries such as rotator cuff injuries, osteoarthritis, any type of traumatic or degenerative condition of the spinal structures, and so on. And recently, and these have been very well studied, recently in the Plastic Reconstructive Surgery Journal, which is probably the #1 surgery journal in the world. I get it because I'm a member of the American Society of Plastic Surgeons. And it's probably the #1 plastic surgery journal. And they recently came out and talked about a huge study which came out in February of this year, which shows the effectiveness of stem cells in things such as facial aesthetics, like what you mentioned, but also reconstructive surgeries. So breast reconstruction, facial reconstruction, reconstruction of traumatic injuries, scar treatments, things such as atrophy of the skin atrophy caused by things like steroids. We can use that for connective tissue disorders or what's called autoimmune disorders. You can use it for that. So there's a whole host of things that you can use the stem cells for, but certainly can help people with chronic pain as well too, either caused by joint degenerative conditions such as back pain and hip pain and shoulder pain and all these things, but also things like fibromyalgia and different conditions as well.
Okay, so we're still here speaking about stem cells, but who would stem cells be catered to most? Because you mentioned that it helps with arthritis pain, and I'm thinking about a granny that really wants some relief. She's taken all of the tablets and she wants relief, but I'm also thinking about sportsmen and women who may get injuries as well, that they may be ideal candidates. But I'm also thinking about people who may, be a bit plumper and may have some reconstructive surgery and they want a little extra something to give them that lift that they're looking for. So who should come to Avant Blue and get their stem cells?
Well, I think you're in a lot of categories right there. And the truth is that everybody is a candidate. Recently on CNN, I think it was, it could have been last month, but very recently on CNN, there was a study which came out, which was talked about on CNN, which showed that these cardiologists, these cardiac surgeons, they use adult stem cells and directly injected them into the heart, and that it really improved. And these stem cells they got from bone marrow.
Okay.
All right, and which is another source of stem cells besides the adipose tissue. And they injected these stem cells into the heart, and essentially it is shown to reduce the risk of heart attacks and strokes in people with congestive heart failure or who have cardiac problems. So when we begin to ask who's a candidate, it really is pretty wide. But certainly, the person who I would say is probably one of the most straightforward people to treat would be persons who have chronic pain from exactly what you're talking about. Things like rotator cuff injuries, things like shoulder injuries, knee pain, arthritis, back pain, chronic muscle pain or neuropathic pain like fibromyalgia and these type of things. These type of people definitely can benefit from the use of their own stem cells or what we call personal cell therapy. So it's really important when you're doing research on stem cells that you look for a couple of keywords. Number one is autologous, which means your own. All right, adipose derived, which means it can come from body fat, and also adult stem cells, which means that these are multipotent cells that can differentiate into bone and cartilage, heart tissue, endocrine tissue, also liver. So people who maybe had too much alcohol in the past, for example, and have some issues with their liver can benefit from stem cells as well too, or people who've had hepatitis, these type of persons. But it's really important to understand, as I mentioned, that the stem cells are still in the investigatory stage. I mean, it takes a really long time, like decades, to really nail down certain things, and it's a field that continues to evolve. So it's very important that we know that stem cells 100% work, but sometimes the question is this person an ideal candidate for stem cells? And the good thing about taking autologous or adipose-derived stem cells is that you can't lose. In other words, there's no downside to it, all right? It's just using your own cells. So you're not going to reject it, you're not going to react to it. The question is, how much benefit do you actually get? So it's really important people come in with a kind of open mind as to how this treatment is going to give them. And definitely athletes are excellent candidates for it as well too. As I mentioned, I got some sporting injuries that really helped a lot. Yeah.
So tell me a bit about how you went about getting your certification to be able to not only harvest these stem cells, but offer them to your patients.
Sure, absolutely. Well, the first thing that you need to be able to do is that you need to learn liposuction, right? That's the most important thing. So in order to do that, you should be trained, all right? And we also train other doctors now in how to perform the art and science of liposuction. But I do have board certifications in aesthetic plastic surgery. So you have to go through all of the training, you have to go through get certifications, first of all, in general surgery, get certifications in head and neck surgery, go back to the anatomy lab. You have to go through fellowships. I did a fellowship in plastic, reconstructive, and aesthetic surgery. Then I did a specialist master's, which is only available in Latin America, in aesthetic plastic surgery. So yeah, there's a lot of training which goes on behind the scenes in order to deliver the capacity for somebody to adequately and successfully be able to harvest these cells in a safe manner while adding some aesthetic benefits, right? Because that's the whole purpose behind liposuction. And then beyond that, then it's just continued training, CMEs. So you go to courses and get retooled on the concepts, and you purchase the right equipment, get trained on how to do that. So it's an ongoing thing. It's an ongoing thing, but the foundational training definitely has to be there. So now we're able to offer training for surgeons. So many new doctors who are newly entering the field of aesthetic plastics, and they come to us and we train them how to do liposuction as well as other procedures. And so this will certainly be something which is within their skill set eventually.
So what are some of the myths that people have about stem cells that you can debunk today?
Sure. Well, a couple of the myths, I mean, there's just like so many, right? But the first myth that we need to debunk is that this whole concept is unsafe. That's just not true. Are there considerations? Are there safety considerations? Yes, there's safety considerations, but to say that it's unsafe and that you shouldn't do it is not accurate at all, okay? You don't want to throw the baby with the bath water, but we do need to know what the baby is and what the bath water is. So once you understand that, then you can safely offer these procedures, and or you can safely offer the utilization of a person's own cells, you know, for them at any point, all right? So that's really important to understand, that you don't have to panic when you hear the word stem cells, or you don't have to get post-traumatic stress disorder because of some crazy stuff that used to happen back in the day in Barbados or anything like that. You can have the utilization of your personal cells. So I think what's important to understand is that people do need that reassurance. So this is important that you ask that question, because people are reading in the news, they're listening to the news, and stem cells are always in medical news because it's just cutting edge, and sometimes they're using stem cells right now to produce 3D printing of different organs. So once you're doing the 3D printing of the organ and you have the stem cells overlaying this organ, you can actually produce a beating heart from somebody's own stem cells. So you don't have to find a heart transplant, you can actually create a heart for this person. It's just incredible to think about it, and these things are going to become even more so as we think about AI and robotics coming onto the scene. So if you combine artificial intelligence with robotics and with actual stem cells, you are changing the face of medicine. So it goes
saving a lot of lives as well.
Yeah, you can save a lot of lives. You can do all sorts of things. It's crazy. You're talking, literally speaking, turning back the hands of time. Because right now, one of the things that they're doing is that they're learning how to turn off and on the aging components of cells. So they did this in mice and rats, where they can cause this rat to age and then they can turn it back and cause it to get younger. So it has incredible, so things such as aging, which we take as a blah blah blah, you know, this is gonna happen, or dang, this is gonna happen. You know, these concepts are now on the cutting edge of medicine, okay? So it really begins to get into some interesting territory, but the important thing is that people are seeing these things, and on the internet, they're seeing these things on news like CNN, like I just mentioned, and they're asking, okay, will I ever be able to access something like this? And the answer is yes. Now, it's very important to let people know what claims can be made about the utilization of your own cells. And I think that once people get into understanding what it can and can't do, then they're going to feel a lot more comfortable.
Okay. And what's the recovery time? If I was to come in, get the liposuction, get my stem cells applied wherever, how much downtime would I have?
Sure, it's zero downtime whatsoever, okay? Even if you're doing like a large volume of liposuction and you're doing the stem cells in addition, just with that procedure alone, you pretty much recover by the next day. Okay, so if you're doing a mini liposuction, your recovery is immediate and there's no downtime. With a large volume liposuction, you may have a couple days downtime, but you can really go right back out to work within 2 or 3 days. Any discomfort which you experience tends to be a little bit of soreness from the area of liposuction, which goes away pretty quickly. And but also you may get discomfort at the site of the injection of the actual cells. For example, if you're going to the knee, for example, or if you inject into the rotator cuff or muscle, you might get some soreness in those areas. But typically speaking, that is self-limiting. That tends to settle down. You can also give the stem cells intravenously, which is important to understand. A lot of people say, well, you know, it doesn't make sense to put the stem cells intravenously. And the reason why they said I understand, because at first that's what I was thinking too. If you put stem cells intravenously, you know what's going to happen. But stem cells are smart cells. So that's the whole key to understanding stem cells, is that they're smart cells. They're going to go where they need to go. Okay, so they look for sites of inflammation and damage, and they will attach themselves into that area and help to repair that area. So that's really important to understand too. So oftentimes people who come for stem cells, just like myself, as I mentioned, I did stem cells directly into my knees, but I also had them done intravenously.
Intravenously means ingested?
No, intravenously means into the vein.
Oh.
So like with a drip, so you put it into the drip, and then you run it through a filter, and you can inject the stem cells straight into your bloodstream.
Okay.
And then they go where they need to go, so because they're smart cells. And the blood goes everywhere in the body.
And for persons who are watching this episode
Sure.
online and they want to know how they can book or how they can come to get this cutting edge technology, how can they do that?
Yeah, absolutely. Just give us a call or send us a WhatsApp at 246-256-5202 or 246-256-5200, or hit the link in the bio, right? Because we're going to put this online, so you can hit the link in the bio and that takes us straight to make an appointment.
Okay, so that was another episode of the Blue Vue here at Avant Blue Aesthetics, and we're inviting all of you to hit the subscribe button on our YouTube video and head over to our Instagram page, Avant Blue, for more information.